Autism. Not unlike numerous psychiatric disorders, there are quite a lot of misconceptions that are formed in relation to it. It is a serious chronic developmental disorder that impairs one's ability to communicate and interact. It impacts the nervous system and affects the overall cognitive, emotional, social, and physical health of the affected individual. The period of disability can last for years or be lifelong. People with autism often have trouble understanding what other people think and feel. This makes it difficult to express themselves not only through words, but also through gestures, facial expressions, and tactile actions. This may also cause a hindrance in their way of learning and education, as their skills develop comparatively unevenly. But a factor that makes them distinct due to their unique learning method is their unusual excellence in certain fields such as art, music, math, or memory. This comes under light due to their exceptional performance in tests of analysis or problem solving. Some of the most common symptoms that we must have witnessed and registered as standard indicators of autism are impulsivity, speech delay, limited attention span, lack of interest in conventional media, and sensory sensitivity. However, these are just a few of the symptoms exhibited by one of the autistic spectrum. The number of disorders in the autistic spectrum can be narrowed down to 4: Aspergers Syndrome, autistic disorder, childhood disintegrative disorder, and pervasive developmental disorder. The Asperger's syndrome is the least on the severity scale of the spectrum. These people don't face any problem in learning and are often categorized as above average, but they have social problems and a narrow scope of interest. The perfect example of this syndrome is Sheldon Cooper from the TV series The Big Bang Theory. The common symptoms I mentioned earlier are associated with the autistic disorder, which affects children younger than the age of 3. The childhood disintegrative disorder causes children to lose most of their communication skills after 2 years of their typical development. And finally, the pervasive developmental disorder, or the atypical autism, is used in the diagnosis of this disorder when a child does not fit into any of the mentioned categories. The cause of autism is usually due to genetic factors or the exposure to hazardous substances to pregnant women, but the exact reason why it happens is still unclear. This disorder cannot be completely treated, but can be significantly reduced with behavior therapy and sensory processing, along with antipsychotic medications diagnosed by a psychiatrist and neurological consultation. Inclusiveness is the key to group harmony, which can provide beneficial effects in improving the lives of people with autism. We must play our part to provide them with a healthy, non-abusive environment. Nurturing and encouraging them as we would with our friends who do not have the disorder is the only and essential way of providing them with this environment. On this World Autism Awareness Day, let us put in a little more effort and help them live a life of happiness and growth. Thank you.